Today, we'll be focusing on geographical distribution of type 1 diabetes, specifically in the U.S. When diabetes was first discovered, its origins and natures were a mystery, and it was seen as a death sentence with no optimistic outcome. This led scientists to begin the search for a way to diagnose diabetes, discover more about the disease, and how to suppress these side effects and prolong the death from the disease. Scientists discovered relatively early on that a way to determine if a person had diabetes was to detect an elevated presence of sugar in one's urine. Once they knew how to detect the disease, scientists uncovered new ways to treat and suppress the symptoms. The first treatment they deemed effective was increased exercise. Doctors later realized that changes in one's diet would also be beneficial and was especially effective when paired with exercising more. Even still, diabetes was consistently leading to premature deaths, and everyone found to have it. But then, in the 1920s, scientists made a major breakthrough of using insulin as a form of treatment, and today it's still the primary form of treatment for diabetes. Additionally, diabetics are now able to test their blood sugar levels at home and are able to control their blood glucose level, thereby reducing the risk of health complications resulting from diabetes. As for the U.S., diabetes rates have now practically doubled over the last 20 years. Diabetes is the seventh leading cause of death in the nation. More than 29 million American adults have diabetes, and it's predicted by the CDC that 1 in 3 adults could have diabetes by 2050. Let's take a look at what cross-national trends actually look like today. Type 1 diabetes is a disorder characterized by abnormally high blood sugar levels. In type 1 diabetes, beta cells stop producing insulin. Insulin controls how much glucose is in your body, and a lack of insulin means that your body cannot use glucose for energy or to control the amount of sugar in the blood. Symptoms include high blood sugar, frequent urination, blurred vision, loss of feelings in your hands and feet, weight loss, fatigue, and excessive thirst.
Although causes of type 1 diabetes are unknown, certain factors into developing disease occurs when certain genes such as HLA-DQA1, HLA-DQB1, and HLA-DRB1 increase. These genes belong to a family called the human leukocyte antigen complex. This complex helps the immune system distinguish the body's own proteins versus proteins made from outside. Type 1 diabetes is generally considered to be an autoimmune disorder. Autoimmune disorders occur when the immune system attacks the body's own tissues and organs. People with type 1 diabetes eventually have their immune system damage the insulin-producing beta cells in the pancreas.
In terms of medical costs and lost income, it is estimated that type 1 diabetes costs the country $14.4 billion annually. An individual with diabetes have medical expenditures 2.3 times higher than those without diabetes. For expenditures, 43% are for hospital inpatient care, 18% for prescription medications, 12% for anti-diabetic agents and diabetes supplies, and 9% for physician office visits, and 8% for nursing or residential facility stays. Indirect costs, $5 billion on increased absenteeism, 20.8 for the reduced productivity while at work, 2.7 for reduced productivity for those not in the labor force, 21.6 for the inability to work as a result of disease-related disability, and 18.5 for the lost productive capacity due to early mortality.
Free fatty acids suppress glucose metabolism in peripheral tissues like the skeletal muscle, which impairs the process of insulin in tissues. Insulin deficiency also decreases the number of genes needed for target tissues to respond normally to insulin in liver. Glycogen converts glucose by glucogenesis when the blood glucose concentration is low. Insulin stimulates the storage of food energy after consuming a meal, which is stored in the form of glycogen in hypophyses in skeletal muscle. Insulin has a global effect on protein metabolism, increasing the rate of protein synthesis and decreasing the rate of protein degradation.
Next, we'll talk about the medical and social aspect of type 1 diabetes. People with type 1 diabetes attending school require ongoing medical care during school hours. By the school, a Bill of Rights for children with diabetes, diabetic children are allowed to check blood sugar, use emergency sugar to treat hypoglycemia, inject insulin, drink water, use restroom whenever necessary, eat lunch at appropriate times with enough time to finish. Effects can involve the struggle to fit in. This is extremely prominent for children and young teens. Bullying can be an issue. Intensity of sports and physical activity may have to be accommodated due to the effects on glucose levels and the reaction to change to insulin and food. Career, jobs, work-life accommodations may also be necessary due to risk of hypoglycemia, working shifts that disrupt sleep schedules or eating. Our population, adults with type 1 diabetes experience lower health-related quality of life, were more frequently unemployed, had more sick leave per year, and were slightly better educated. Differences in health-related quality of life and employment increased with age and were larger among women as compared to men. No significant differences were found with regard to working hours.